talk about high blood pressure or hypertension or the pressure, let's try to understand what blood pressure is. So in order for your blood to go through the tubes, there's tubes that carry blood all throughout your body, from your brain down to your feet, and the heart has to pump that blood all around the tubes throughout your body. So there's a certain amount of pressure, we call that blood pressure, that's important, that you need that to punch the blood around. But when it gets too high, that's what can cause high blood pressure or hypertension. So for example, when you look at a garden hose, there's a certain amount of water that comes out of the garden hose. If you need more water to come out, more blood to go through your body, you need to increase the amount of volume that you have, or the amount of blood, or you have to increase the pressure on that to get the blood to circulate. What happens when you have too much pressure or your blood pressure gets too high? I think the challenge is that we know we need a certain amount of pressure for that blood to flow through the body, but when it gets too high, it puts strain or pressure on the heart, and it puts strain on the organs of the body where the blood flows through. So the things we really worry about is your vision or your eyes. Some people, but they have too much pressure, can lose sight. When your kidneys have too much pressure on them, it can hurt your kidneys, and some people may eventually have to go on dialysis. So these are all the things we want to prevent. Once you have high blood pressure, there's lots of things we can do to help prevent them. So there's lots of different things that you can do, and always, I think, talk to your doctor or healthcare provider about kind of the best ways to approach starting them. But the things we think about is salt. Lowering the amount of salt that you take in, and some people are really sensitive to that. So, you know, I've had patients that lowered their salt and their blood pressure has really come down. And some people, lowering the salt doesn't have as much of an impact, but that's something very important, lowering the salt. If you're overweight, losing weight, and again, working with your healthcare provider to figure out the best way to do that safely. Another thing is kind of trying to get more physical activity and be more active. Walking around the block. This doesn't have to necessarily mean going and running a marathon, but you know, getting up if you're at a desk, walking around, just getting more activity in your daily living. And the other thing that's important is the medication. So we have a lot of different medications that help lower your blood pressure.